again this is part of my students' presentation for dissertation itself, MSc PG dissertation. This was on the rheumatoid arthritis and the long pepper, which we tried on the patients, selected patients. We all know that RA is an autoimmune and inflammatory disease, which means there is like pain, swelling in the joints, and sometimes it may lead to disability also. So we have the pains in the knees, in the leg as well as in the hand also, where there is joints that take place. So it is because of the drying of synovial fluids also. Now, because of this RA, usually as I said, it affects the joints. Because of this RA, there are many complications that may lead to it. And here the risk factors that are there. So in India, around 80% of the patients do have this RA between the age group of 35 to 50 years. And the risk factor or the complication is it may be due to hereditary or the age or the lifestyle and even the pollution also, and complication it may lead to any heart diseases like stroke or heart attacks. And the major problem, the other problems are risk factors are like the consumption of drugs or smoking, etc. So management is usually exercise, sometimes rarely it is surgery, and it is nothing but ultimately it is the dietary supplements which will be given. So this, usually we go for steroids or painkillers and some non-painkillers also, steroid components also. But ultimately, there is no end for it because it continues. So whenever there is pain, definitely you have to repeat the process over there. So instead of going for the steroids and painkillers, which has got its own consequences in the later on life, so it is better to go for component which is a part of our dietary assessment. So as a part of that, we thought long pepper, which we call it as pepper longium, is one of the remedy because it has got many chemical components which acts as an anti-inflammatory. So we just thought of using this and trying to find out a remedy for the patients. So the scope was, since it is it doesn't have any side effects and it is affordable also, that is easy to consume and affordable, we thought we'd try with this. In fact, along with that, we also tried with the turmeric powder also, which is again very important, and combination of turmeric and ginger also we have tried. All the three components have shown to be an excellent remedy for this arthritis. And we did the three also, we did on different people and different areas also. But here I am just presenting with the long pepper. So the objective was, as I said, it is safe, economical and effective remedy. So we thought of using this, and research design, we had 60 patients. We did not select, we just selected a area, that is the southern part of our Karnataka. So we selected that area where coldness was there and humid temperature was there, and we selected the people according to the stages, that is mild to moderate stages which were there, and was there. Lifestyle information also was taken into consideration to know the type of diet, and even the other informations like smoking, etc. was also considered. And the biochemical assessment were also done, and one of the components of the Ayurveda, that is Nadi Pariksha, also was done. Now apart from that, Nadi Pariksha, that is,
has any scientific base?
No, it doesn't have, but the pulse rate has been considered. In fact, biochemical, we did the ESR test was done, RA and ESR test were done. Now, what we did was we gave pinches of powder. So, first day it was just one pinch, which was equivalent to around 2 grams. And early morning with milk it was given. We increased up to 10 days. Then after that 11, that is when
you worked on this Pippali
yes.
specific
Yeah, it is just the lavanga they take, no, it is long, lengthy one which is there, and that powder, the whole fruit has been dried and yes, it is fruit, herbal fruit
We have
itself.
selected this because there are some evidence.
Yes,
of
we had
ancient
ancient. I actually had literature also. We have in that is Charaka itself. We have this information about its characteristics. Yes, characteristics itself because of its characters. That is anti-inflammatory characteristics. We selected this. Just like turmeric, this also has got antiseptic as well as anti-inflammatory characters. That is why we selected. So these are the dosages which we did. And as I said, we selected only few patients who had come for OPD, and then they were distributed. So we saw even BMI was also taken into consideration because that may also aggravate the situation because they have got sometimes they get disability of walking also. So it does matter. So we took the BMI and classified them according to the BMI as obese normal, overweight, obese 1 and obese 2. That is obese 1 is about 10, overweight is about 10% of the normal, about 10 to 15% it is overweight and grade 1, and above 15% it is grade 2. Then the activity performance, we found few people, only few in number when we just took, only 5 of them had normal working capacity, but others had some disability or difficulty in performing the normal activities also. And we took pain they cannot express. So what we thought was we took the emojis, which is the standard expressions that has been given for any pain. So according to that we had this pain scale also that has been done. So we asked them to just click for erythrocyte sedimentation rate and then RA factors and CRP also. So we could see the change after the treatment. We could see the change from a shift from the pain also. So to conclude it, I say that the result of this survey showed that about 63.3% had a positive effect, and of course 36.6% patients did not show much satisfactory improvement. But however, we could say, and the time limitation was less because they used to come only, we could connect them only for 30 days when they were in the hospital. So that was one drawback which we had, and we are continuing that this program is further also. But yes, thank you.
Anybody have a question?
Did you consider any specific age group, ma'am?
Yeah, I told her 35 to 60 years. 35 to 60 years we had considered. Those who had would come to the clinic, so that pain which they had. So only those patients who gave consent definitely were considered. And it was given in the milk early in the morning. We used to give them 2 pinch in the milk, along with the milk we used to give them.
I mean, in this generation, younger people also getting this kind of.
Yes, yes.
So why did you consider this take into the consideration?
No, we just see it was depending upon the patients, type of patients who are coming to the hospital. Only those patients we had, we took this, and this, since it was a pilot project, we just thought we go only for with the patients, not the whole community. That was the thing. So we may extend, because I told you we took up even turmeric and ginger. So turmeric we have done on individuals who were working in textiles industries, Kumta. So Western Ghat, there is again because of the weather condition and sitting for a longer period of time in the textile industry, we found them also. So we have taken different different area also over there. So probably we'll extend to the younger generation also in future.